Hey guys, this is Professor Arunachalam here, and continuing with the need for functional exercise prescription. Last class we saw about how the brain remembers certain activity. So why we did that primary presentation was you can remind the brain about whatever the function it was doing before, and you cannot remind the brain about an activity which it has not done before. So just remember this wording. At the end of the presentation, I would be explaining to you about that. So there is a problem in exercise prescription as such in particularly the clinical setups in physiotherapy in India particularly, because there is a problem of convention. So what is this convention is nothing but my senior taught me these things, my teacher taught me this thing. I was taught like this in my BPT and MPT. So I am practicing this. I might have finished my course nearly 10 years before, 5 years before, 20 years before. It differs. So there is a lack of updation of knowledge among clinical physical therapists, which has to happen. Otherwise, we would be all sticking up with the same set of exercise prescription as such. We may teach many exercises, out of which most of them may be not so relevant to the condition, but at least 2 or 3 exercises, if they are relevant to the condition, that would help the patient. That is what we intend to in this presentation. A classical example for this is your spinal extension exercise in prone lying, the bridging exercises, the so-called pulley exercises, and your very famous quadriceps exercises, quadriceps drill, and the isometric quadriceps exercise. So one very important thing that underlines all these exercises, what we give patient is, they're all single joint exercise, single muscle exercise, to be very specific. It attests to a single muscle. If you see a quadriceps drill or an isometric quadriceps exercise, it pertains only to the quadriceps. If you give an exercise that is a spinal extension exercise, you think your the stabilizers of the muscle, the core muscles are going to work very effectively, but that is not going to happen. That is what science has proved in the recent past. So we should stop giving exercises which are not so effective, or at least prescribe some of the exercises would be so that are very effective along with the conventional exercises, because it is very tough to eradicate everything all of a sudden. The changes will not happen all of a sudden. So why I'm presenting you this thing is, I'm just trying to prepare your mind so that you would be able to receive whatever information I'm saying. This is only for budding therapists who have an idea to update their knowledge. It is not for the expertised. So this is my disclaimer. So if it is very elementary, please don't mistake me. Okay, so the main funda of a physiotherapist is prescribing exercise and others prescribing exercises. Physiotherapist should take care of 2 things very importantly. You should protect the joint from excessive forces. So when I say excessive forces, I'm not saying the regular forces for which the joint is designed. You should protect the joint from an excessive force. Okay. Second thing is, you should give sufficient stimuli to the muscles, the joints, the other structures around the joint, so that it helps in restoration of the normal function. So I have given these 2 things in red and this thing in green, because we normally do the red one. We always protect the joint. If a patient comes with knee pain, we very easily tell him that you should stop doing walking, you should stop sitting on floor, you should stop climbing stairs. We protect the joint, but we should be very clear whether we are protecting the joint from the excessive force or the regular force that is needed for the joint. That is very, very important. A classical example is when a patient comes and complains to you about knee pain, this patient who has been sitting cross-legged throughout his life until last month when he got this pain. So if this such patient comes to you, he might be aged 60. Right away, we tell patient that you should not sit cross-legged hereafter, don't sit on the floor hereafter, which he has been doing for the past 60 years. So what we are doing is we are limiting his function. We are limiting his function at the same time. We are we are investing these words in his mind. So whenever in the future he goes to a public place where he is supposed to sit cross-legged on the ground and eat food like an Indian culture, so he won't be able to do that. So it's a social restriction for him. A function what you are restricting him from doing has resulted in a participation limitation in his life. So this is not the justice what we are doing to our patient. That is why I am saying you should protect the joint, but protect it from excessive forces, not the regular forces for which the joint was subjected all these years. The second thing is you have to have sufficient stimuli for the muscle control. So you have to give him some sort of exercises that stimulates and restore normalcy. Remember that exercise have a very fantastic pain modulation. So even with pain, you can prescribe exercise unless otherwise it is not a traumatic condition or a very acute condition where there is an active inflammation. Even studies supports that even when there is an active inflammation, you can start with mild graded exercises, which are functional exercises. So make sure that don't stick on to the convention of contraindicating all the activities that are painful, waiting for the pain to come down for starting up the exercises, because exercises themselves, many patients, many physiotherapists think that exercise can result in increased pain, but that is not going to happen, because exercise in fact has a pain modulatory effect rather than preventing the progression of the recovery. Okay, so remember these two things when you are prescribing any exercise. Why exercise prescription is so necessary? So you'll be thinking that as a physiotherapist, whatever exercise I prescribe is going to be effective for my patient. Even if I prescribe a quadriceps exercise on a quadriceps chair, that is going to help the patient because I'm activating the muscle. Why you are avoiding me from doing all these things? Why you are suggesting me not to go with that? So I have a justification here. You should indicate what is needed first of all. So if a patient says that I'm not able to do sit to stand, I'm not able to walk on a ramp, if I'm not able to walk on a staircase, so that is what you have to re-educate rather than re-educating the individual muscle. Because ultimately the chief complaint of the patient will be not in terms of muscle, like no patient will come and say, I'm not able to activate my quadriceps, I'm not able to stretch my hamstrings, I'm not able to contract my deltoid muscles effectively. So this is not going to be the chief complaint of the patient. The chief complaint of the patient is going to be as simple as like, I'm not able to lift this hand, I'm not able to walk on stairs, I'm not able to stand for a long time. So it is absolutely functional based. So when the chief complaint of the patient is such that you have to attest to the chief complaints rather than attesting to various muscles. So simply, we can say that if you want a person to drive cycle, that is your aim, there is no point in training his hand-eye coordination separately, training him in supine lying, the cycling movements of his leg, and then training his hand function separately, and putting him on a cycle and expecting him to do all these skills at a time in driving a cycle. That is not going to happen because everything is a motor plan. You have a memory for skill. That is what we have seen already. We have memory for facts. You have memory for day-to-day activities. You have memory for skills. So if at all you want to recall something, you can recall from what it has been remembered previously. You cannot do certain new gimmicks and expect the patient to do the learned task. So you should give him the exercises which is highly indicated. And second very important thing is contraindicate if only it is necessary. Don't contraindicate all the movements thinking that it may affect the joints. That is what we have seen previously. Third thing is you should know what are all the red flags that are there for exercise, because when I say prescribe exercises, if there is a red flag, it's definitely you are not supposed to do some exercises. You are supposed to wait for that. So the red flags are not in the this scope of the presentation. So I just leave it to physical therapists to know that. And fourth is very important, should know how much is too much for an individual. you cannot have a set protocol for all the patients. You should know how much this patient can do with good motivation. If I give exercises beyond that, it may influence his motivation. If I give less than that also, that will suppress his enthusiasm and motivation. So all these things you have to take into consideration and prescribe exercises for individual. So with that, I'll stop for this session. So in the next session, we will see about the remaining exercise prescription, how to prescribe exercise for ailments. Thank you so much. Keep in touch. Have a great day.